U.S. officials met with Pfizer executives yesterday. The big focus, whether or not fully vaccinated people will need a booster shot. Dr. Fauci was a part of that meeting, and he joins us this morning. He's the chief medical advisor to the president. And Dr. Fauci, thank you very much for being with us today. I have a lot of questions, and we're hoping you can sort through some of this with us. First of all, what happened at the Pfizer meeting yesterday? What was the internal data that they showed? And did it get you to the point where you think, OK, Americans may eventually need boosters?
Well, it was fundamentally a courtesy meeting. They had made an announcement a day or two before regarding some data from Israel, as well as data that they had collected. They wanted to share it with us because there was obviously a lot of attention publicly to that. So it was a meeting, a courteous meeting where we exchanged information. It certainly was not anything even approximating a decisional meeting at all. Their data, as important as it will be and is likely is really one part of a very larger puzzle of data, as it were, a lot of which will be coming from our own CDC when they look at more than 20 cohorts that they're following to ask and answer the same question. And that is, what is the durability of the protective response? We know for sure that these vaccines are highly, highly effective in protecting you and quite safe. The real question that is being examined right now is, what is the durability of that protection? Does it wane off? And if so, how soon? And if you do a boost, how high do you get the response up? Those were all discussed. But again, as I mentioned, there was nothing that came even close to any decision. It was really mostly a courtesy meeting briefing us on their data.
Yeah, I wouldn't expect any decisions to be made at this point, but it would be interesting to know if the data influenced you. What do you see in terms of the effectiveness over time? Does it drop dramatically over 2 months, 4 months, 6 months?
Well, I can't tell you much about their own data because it's still at the level of we agreed upon confidentiality. I don't think it's going to surprise anybody. The data that is public now is the Israeli data, which they've made public. And as you can see from the data, there seemed to have been a sharp drop in protection against just infection, asymptomatic infection, after a certain number of months. What has held firm is the very good protection against severe disease that might lead to hospitalization.
That's great news, and I'll tell you what we discussed with a doctor who we had on the show yesterday. I've been fully vaccinated. I feel very comfortable about myself. What I feel less confident in is the idea of whether or not I can pass this on to my children who are too young to be vaccinated at this point. The Delta variant, if something else were to come through, how confident do you feel that I either won't pass this on to my children who haven't been vaccinated or to parents who are in a position of being medically compromised? What can you tell us or anybody else who has those same concerns right now?
Well, they're understandable concerns. They're quite reasonable. We're being asked that a lot. And again, we are collecting data now that will allow us to hopefully, in a more confident way, answer your question. I can tell you what data we have that does show that if of a young, otherwise healthy person like yourself is fully vaccinated, even if you do get a breakthrough infection, it likely will be either with no symptoms or minimal symptoms. One of the studies showed that if you examine the level of virus in the nasopharynx of a vaccinated person who has a breakthrough infection and doesn't have any symptoms, and compare that to the level of virus in the nasopharynx of an unvaccinated person who gets infected and has no symptoms, the level of virus in the nasopharynx of the vaccinated person is considerably lower than that in the unvaccinated person, which just would strongly suggest that the likelihood of your passing it on to anyone else is much, much, much less than if you were not vaccinated. Now, the study that does need to be done is the actual clinical observation study to determine the efficiency or not of transmission. And those studies are ongoing now. So even though we have a suggestion of what the answer is, We haven't definitively shown it yet, but we will have that data within a reasonable period of time.
Shepard Smith here. Thanks for watching CNBC on YouTube.